So Kaiser Permanente is a U.S.-based integrated healthcare organization, and our mission is to provide high quality and affordable healthcare services to our members, we call our patients members, and the communities we serve. So we have about 12.3 million members, but there are 68 million people in the communities where we are operating. And when we think about community health, we are thinking about how do we improve the health of those 68 million people. We are a nonprofit, and because we're a nonprofit, we reinvest in the community as part of our business structure. And we have what we call a community health organization. And within community health, we are focused on improving health access, improving health equity, and as well as trying to innovate around how we are improving overall community health. And so we've identified 7 priorities where we're focused. I'm going to focus or dive deeper into 3 of them today. But with affordability and access, for us, that's providing charitable care and ensuring that more people have insurance. Wellness in schools. We work on increasing physical activity and developing resilience. And some of the newest work is around trauma-informed education. And so we're supporting those children in schools who've had adverse childhood events. Economic opportunity, really ensuring that we're hiring local, hiring from diverse businesses, so we're building up the communities where we're operating. And environmental stewardship, we have a goal that in 2020 we'll be carbon neutral, and we're also working on a variety of longer range goals around environmental sustainability, and that's everything from reducing waste and building cleaner facilities. And I'll dive deeper into the other 3 areas around public policy, housing, and social care. So the vision of the community health is really about how are we connecting people to resources. And it's really around using data. It's developing a system that enables us to support the communities and really scaling. Kaiser Permanente operates in 8 states and Washington, D.C. And when we test something in one region, we have the opportunity to figure out what works and scale it to all of our regions. So one of the big areas of emphasis in community health is around public policy. So about 10 years ago, we started a community health initiative that was focused on how do we increase healthy eating and active living in low-income neighborhoods. And we were really focused on childhood obesity. Could we have an impact? And what we learned is there's this dosing effect. How might we cluster strategies together to have a real impact? And there's many public policies that have shown that there is greater health impact. And so that was a study over 10 years. Most of the interventions lasted 4, 7, some still continue to really drive the impact. And to continue that work, we've partnered with City Health, which is supported by the Beaumont Foundation and Kaiser Permanente. And that effort is really looking at the 40 largest cities and trying to make it easier for city leaders to implement policies that do support health. And so some of that is we've heard about today around making the streets more accessible for physical activity and just ease of getting around. It's a lot around affordable housing. What are the paid sick leave policies so people are able to be healthier and have stable employment? And so this is an initiative that's carrying on our initial research and really reaching 40 U.S. cities that go beyond actually the Kaiser Permanente footprint. And so here's a snapshot of Washington, D.C., and we do operate here, but Washington, D.C. was rated a silver medal in the first year of evaluations because they have implemented 5 or more policies in a bunch of these areas. And so they're really trying to make a difference and starting to see some of the health gains. Now, I'd like to move into social care. So for years, Kaiser Permanente has been doing community health needs assessments and really looking at our individual communities and understanding how are they doing. And while there's some variation between regions, it's pretty consistent that the top 3 social needs our members have are housing, financial strain, and food insecurity. As many as 29% of our members are food insecure, and 23% struggle with housing. And this is part of, we get this information from a survey that we've actually integrated into our medical record. And so now we have information that our members provide to us about what they're facing in their day-to-day life. And it's part of the medical record. So it can actually show up as on a problem list, as another health condition would show up. But here we would say housing is a challenge for this member. And so we're really trying to, by putting it in the medical record, really linking all the social needs to the medical needs that we have. But what's always been challenging with this is that once the doctors knew that there was a social need, then what? What would happen? And when we were trying to test some technologies that were designed to, say, support family caregivers, we'd hear from our members that there was this one social worker who always had great resources. She knew what was going on in the community. And we heard this in every region. And so we thought, okay, how do we scale this? How do we take that information? And then how do we be certain that we also aren't overwhelming any of these community resources that exist? So we've done this informally in the regions as we try to meet our members' needs, recognizing that for them to be healthy or to keep their family members healthy, they also need social support. And then we also looked beyond our community, and we just asked our non-members that aren't necessarily in Kaiser Permanente regions, and we said, okay, what do you think of social needs? And so this is a survey that we just did this spring, and 97% of Americans in this survey said they really want their medical providers to ask them about their social needs. It's almost an expectation that we do consider social needs alongside medical care. But only 35% feel that they would be able to find those resources, take advantage of them. And 55% believe all these social needs are really essential to overall health. And so this is something that we're hearing from our members, and now it's also from the broader community. And a third of all Americans experience some stress related to social needs. So this is clearly an issue that impacts overall community health. And so what Kaiser Permanente is doing, and we're just launching this month, is something we're calling Thrive Local. And it's taking what we've learned about how do we connect our members to social needs and making it into a scalable system. So what we're doing is we identify the social needs, and we have those tools in place. We have the current life situation survey. But then we're creating a resource directory that identifies all the social services and public benefits. And then we're bringing in our community partner networks that are specific to the region we're working in. And we're all coming together on a technology platform. And it's closed loop. So our care teams can refer members to these community resources and actually get feedback. Are our members taking advantage of these resources? And while this is being developed by Kaiser Permanente, all community-based organizations can use it for free. And if other healthcare systems want to join in, they'll have that opportunity as well. So we are just launching this. So I hope by next year we'll have some more data on this, but this is really something that we've been working on for at least 10 years and finally putting this into a system to address and to have that feedback to know, does this make a difference for our members, and how are those community-based organizations doing? Do they have the bandwidth? What support do they need? So that we're making sure that that whole community is thriving. And I'll finish with affordable housing and homelessness. So of the 10 US cities with the largest homelessness population, Kaiser operates in 6 of those. We're headquartered in Oakland, California. Alameda County, in the last 2 years, has seen their homeless population grow by 43%. Other Bay Area counties, it's grown by 30%. It's a real challenge, and we are not housing members of our communities well. So Kaiser Permanente has looked at this immense challenge and identified several ways that we wanted to get involved with this. We believe that for anyone to manage their health, they really need stable housing first and foremost. So we want to end chronic homelessness. We want to increase the affordable housing supply, shape policy, and really transform healthcare and housing and couple those a little more, and then continue to innovate, especially in this area. So one of the partnerships that we formed is with a group called Community-Based Solutions, and we're trying to end chronic homelessness. And in the Kaiser Permanente footprint, we're working with 15 communities that we hope to end chronic homelessness. The approach is focused on data analytics and really speaking with those who are homeless to understand what are solutions that might work for them and learning best from them. And then really testing solutions and seeing the solutions that have the greatest impact to have people temporarily housed and then permanently housed, and then how to facilitate those solutions and scale them. We're also trying to increase supply of housing. So we've announced that we're investing $200 million in addressing affordable housing. And this is we've created 2 investment funds, one designed to preserve affordable housing in the Bay Area. What's happening is people are getting displaced. Rents are increasing, and people who had stable housing are increasingly becoming more vulnerable. And the other part of the fund is to actually develop new affordable housing. There just isn't enough in the regions where we operate. So we are going to end homelessness in Oakland. It's a bold statement. If anyone's been to Oakland lately, you'll know it's very bold, and I hope we get there. We have partnered with Bay Area Community Services, and this is, again, a very data-rich project because we've identified 515 individuals by name who are over 50 with at least one chronic condition who are homeless. Many of them have been displaced in recent years. And so since January, we've been able to house 300 of these residents into more stable housing. And Bay Area Community Services provides job support, stability to keep the housing stable, and then also working on mental health services and starting to get into some of those other social support needs for these individuals. We've also partnered with another community agency to purchase a building to preserve affordable housing. And so we are trying all different ways to see how do we have people in more stable housing and enable them to manage their health once they have that housing. And I end with this slide because we talk about data and we talk about systems, and it really comes down to the people and making those individuals' lives better. And so I leave you with this because we always want, it's been exciting to use that data to actually name the people that we're supporting in the community. Thank you.
Thank you.